At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Centers.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. So I'd like to start off each and every week. I'd like to say hello to all our loyal listeners. Of course, thank you for listening, and a special hello to anyone who's new to this radio show. This, again, is BackTalk. With myself, Dr. Peter Pedduzi, we're on every Wednesday morning on KHB, 6:20 a.m. from 9 to 10 in the morning. If you are new to the show, of course, welcome. In the first half hour of the show, in the first half hour of the show, we typically talk about the very unique and wide variety of treatment options we offer all under one roof right here at the American Back Centers. Of course, a brief history as I give you each and every week. Dr. Dennis Miskovich started this practice over 40 years ago here in the local Wexford area. He's one of the first chiropractic doctors in this area, way back when this area was almost a ghost town. Unbelievable how things have changed out here in just the last 10 years, let alone 40 years. In the last 20 years, roughly 1994, when that groundbreaking research came out by Drs. Ramos and Martin, two neurosurgeons, which I talk about on this show all the time, published in the Journal of Neurosurgery, showing for the first time, and so to date, and this is so important because there's so many of these so-called disc decompression treatments out there making claims, actually in some cases using the research that was done on VaxD and claiming it was done on their procedures. And you have to be careful with this. There's a lot of people out there with questionable devices trying to mimic or copycat what VaxD does. So this research is done way back in 94, published in the Journal of Neurosurgery. Dr. Miskovich saw this research, saw the great success that was beginning to occur nationwide, now worldwide, with VaxD therapy. VaxD was approved by the FDA, put on the market, and again, many reputable research studies done by insurance companies as well as VaxD, as well as other independent sources, have verified and continue to verify the effectiveness and the safety with this very well-researched treatment. Approximately 3,000 patients a day are being treated with VaxD therapy. Some of the greatest athletes in the NBA, NHL, that's where it started up in Canada. So a lot of the NHL referees, Mario Lemieux had VaxD. A lot of the people in the NFL, athletes in the NFL, Olympic athletes. We've had some celebrities here at our office. A wonderful, wonderful procedure that's helped many, many people. And it has a extremely high success rate, especially if you go to a facility. And most of the facilities alone, just with VaxD alone, have an extremely high success rate. But a more experienced facility like ours, we've been doing this for over 20 years now, since 1994, one of the first offices in the country instituting VaxD therapy. And since we've been known as the area's disc specialty center, we've been doing it longer than anyone in this area, and we have the best treatment option called VaxD therapy. And we actually have two tables instituting this VaxD therapy. And it's a whole protocol. In addition to the therapy, we have a whole protocol. We've perfected our protocols. We've gotten better over the years, seeing what works with patients. Patients that come into our office, we will not accept you for VaxD if we don't think we can help you. And we have a documented over 92% success rate if we accept you for care. Nothing comes close to that. And this is permanent correction, not a temporary correction. It goes along with the rehab that we give you and all the other modalities and protocol that goes into the disc-specific protocols that we have here at the American Back Centers. But before we get into all that, and that's typically what we talk about the first half hour or so, if you have any questions, feel free to call in 412-825-6262, 412-825-6262. Any questions about back? It is called BackTalk, but you can talk about anything that's on your mind as far as health-related, especially pertaining to disc problems, which we'll touch on here in the next half hour or so. In the last half hour, we typically talk about a nutrition or a fitness-related topic, and when we talk about different things, last week we actually had to run a tape. Last couple of weeks we've been talking about very interesting health topics from various sources. This week we have the top 4 household factors that can influence your cancer risk. So very interesting. If you don't have a computer or printer or the internet, you can go to, actually we can send it to you free of charge. Just call us and give us your name and address and we'll send it out to you. If you have a computer printer, go to Mercola.com, MERCOLA.com, and you can print this off. Or, even easier, you can go to our Facebook page. Our Facebook page is American Back Centers Pittsburgh. American Back, BACK, Centers, Pittsburgh. Go on our page. We'd appreciate it if you take a second to like our page. You can request a friend request if you'd like to friend us, as well as, and when you friend us, you can, or like us, you can get all of our information sent to your email page automatically. I'm sure you know how Facebook works. But also, you can go to the page and print this right off, as well as some of the other articles. I think I mentioned this 2 weeks ago when we were live. I think it's been about a year now that we've been putting on articles. So it's pretty much the last almost year that we've been doing this. We post, when we're live, the article right before we go on the show. And so you can take a look at it. You can print it off. If you missed the show, you can go on there and take a look at what we talked about as far as the health, nutrition, fitness topic in the second half hour of the show. Next week, I don't think we'll have time for this this week. It's something that I don't think anybody wants to hear. We all use our cell phones. How cell phones can cause brain tumors and trigger chronic disease. Now, we're not trying to scare everybody here, thinking that by using a cell phone, you're automatically going to get a brain tumor. But there's a lot of diseases, including chronic fatigue, bipolar disease in youth, fibromyalgia, autism, celiac disease, HDHD, lupus, hypothyroidism, sleep apnea, the list goes on and on and on, that although these major health threats, he goes on to say, the major health threat continues to be cardiovascular disease, cancer, and infections. It should be noted that this following list that we just mentioned of conditions often create significant challenges in the lives of those who suffer. Some of these diseases we just mentioned were not even public knowledge prior to 1980. So we've seen a dramatic increase. He has a table here, 1,100% increase in chronic fatigue since 1990. 10,000% increase in bipolar disease. And we'll talk about this next week. And there could be some possibility linking to these electromagnetic fields that are put off by cell phones amongst, we'll talk about your Wi-Fi in your home and different other things as well. And there's some simple, easy things you can do, like turning off your Wi-Fi at night. And we'll touch on some of these other things you can do next week on the show. So just because you have a cell phone doesn't mean you need to throw it away. You're not going to automatically get a brain tumor, but we're going to touch on some of the ways you can help prevent these issues next week on the show. So definitely stay tuned for that. Again, how cell phones can cause brain tumors and trigger chronic disease. We'll touch on that next week on BackTalk. All right. So, of course, as we talk about each and every week, at the American Back Centers, we are not your typical chiropractic office since 1994. As I mentioned, the American Back Centers has specialized in the treatment of very difficult cases, including herniated disc, bulging disc, failed back and neck surgery, sciatica, stenosis, degenerative disc disease, and other serious health-related issues. As we mentioned, failed back surgery. We've had people with multiple failed back surgeries, even if you have a fusion surgery. If it's only one or two segments, those areas above and below are now compensating for that fixed segment that, yes, the fusion is being addressed, I should say the compression is being addressed, which is the true cause of the problem, which they failed to address in the discectomy surgeries when they just snip off a piece of the disc through laser, which is costing you anywhere between $20,000 to $40,000, or a scalpel, which is typically covered by your insurance. But the compression is not addressed. As we talk about each week, the compression is the cause of the problem in most cases. When you take a pain pill, when you do an epidural, when you do physical therapy, you're not addressing the actual cause of the problem. The physical therapy, in many cases, which we do here at our office, we do therapy and rehab, will strengthen and help the body heal itself. And it does do that in some mild cases. But if you're not responding to physical therapy, because it's not really pulling the disc back in, or you have a more serious or more severe herniation, protrusion, tear on your disc, annular tear, or even an extruded disc. Those type of cases, you run the risk of allowing the condition to get worse. If you already have bone spurs, osteophytes, degenerative disc disease, severe in nature, these type of things cannot be corrected in most cases by just doing physical therapy and strengthening your core per se, which we do at our office, but we take care and treat the disc, the compression problem first. And that's a big issue. And with surgery, even fusion surgery, as we go back to what we were talking about, those areas above and below that now are compensating for that fixed segment that can't move, that used to be able to move and is supposed to move, kind of like taking a link out of a chain, now suffer. So we can help you open up those spaces, allow fluid and nutrients to come back in, and actually treat the cause of the problem, not just put a Band-Aid on the problem. So VAXD is a time-tested treatment, very safe treatment, very cost-effective treatment, used in over 300 hospitals, medical clinics. There's a few orthopedic surgeons that use VAXD in their office, chiropractic physicians, physical therapists using this worldwide now, as we mentioned, 3,000 patients a day using VAXD, not these so-called decompression devices, these traction devices you see in the corner of your doctor's office that are rarely used in some cases. Some of these are dressed up with these fancy columns and computer screens and television monitors, but the fact of the matter is, if you look closely, they're simply just a electric winch and motor, a traction device, covered up with some fancy TV screens and columns. And again, I would ask the doctor, what is the name of the procedure? There's so many doctors out there now that are hiding the actual name of what they're doing, because number one, it's not a VAXD, and number two, it's just a glorified traction device, and they make up all these names for all these procedures. I've seen so many decompression, spinal decompression, neutrodismosis, so many different things that are not telling you what the name of the procedure is, because they're trying to cover that up. Because if you actually dig back deep, you'll actually see that these devices were either taken off the market in the past because they hurt people, they cause problems, or they just simply don't work, or they're just simply, as we mentioned, glorified traction devices masquerading as a VAXD procedure. So again, if you're out there listening, as I say each and every week, if you're out there listening, you yourself have these type of problems, you know someone who has these type of problems, suffering with back or neck pain, we'll talk about the neck disc treatment options here in a few moments, unresponsive to your current treatment, you want to avoid further pain medication, epidural pain shots, you're going to a pain clinic, physical therapy not working for you, surgery, you've been told you need surgery, you want a second opinion first, you've already had surgery and it's not worked for you. Second, third, or fourth, or even more back surgery has not worked for you. Your symptoms are radiating into your hip, your buttocks, your groin, down your legs, numbness, tingling, weakness, even foot drop. We help a lot of people when their condition progresses to a foot drop where their foot is dragging, their foot is weak. When we take that disc off the nerve, we can restore that. I always laugh when patients say, well, can I just do a couple calf raises to get that strength back? But if you look, and you really look at this closely, you'll see that it's not a function of the actual muscle itself. Of course, it's a nerve. The nerve is not able to allow messages to and from the brain because it's being impinged upon by the disc or any bony structure that may be compressing it from your condition. So when we open that up and relieve that compression, whether it's a bone spur or a disc hitting on the nerve, open up that spinal stenosis, that narrowing, that degenerative disc disease, that herniated bulging disc, pulling it back off the nerve, then all of a sudden that foot drop, that strength returns. That foot drop disappears. Again, VAXD is the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there. There's a lot of people make claims similar to VAXD, but if you look closely and do the research, you will see VAXD was the first and still the only device that's been approved by the FDA for these type of disc problems and actually does what it says it does, and it's backed by clinical research. And it's been used for 20 years and will be used for another 20 years because it works. And again, if something's been around for a while and has helped people and continues to be around, it must work. It's very simple, common sense to me. So again, these conditions include herniated disc, degenerated disc, posterior facet syndrome, degenerative joint disease, arthritis, sciatica, stenosis, and even failed back surgery cases. We see them all the time. We can't help everybody, but what we'll tell you when you come in for your consultation if we think you're a good candidate for the care. And if you are, we have a documented over 92% success rate. The unique vaccine treatment table is protected by patents issued in the U.S. as well as internationally. Again, we are doctors, over 300 doctors, physical therapists, orthopedic surgeons, medical doctors, chiropractic doctors out there across the country as well as worldwide now, dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Again, don't wait until your condition worsens. Call us today. Our toll-free number is 1-888-222-8293. Again, 1-888, not 1-800, 222-8293, or 724-935-3300. Again, 724-935-3300. Also, we do encourage a lot of people, I mention this each week, you can fax over MRI, CT reports. Of course, you can fax over the films. If you know how to scan a film onto a disc, you could, if you have the films on the actual films on a disc, you can actually email them. If you know how to do that, to our office, our email address is Dr. Pedduzi at AmericanBackCenters.com. Again, Dr. Pedduzi at AmericanBackCenters.com. But it's very simple. If you remember, you had the films done, just call that facility, and then in many cases you can just tell them to fax over the report, MRI, CT, X-ray report, to our office. Our fax number is 724-935-3321, 724-935-3321. And of course, you can get all this information on our website as well. If you missed that, our web address is www.AmericanBack, B as in boy, A-C-K, centers, plural, .com. You can actually request an appointment on the website. You can see all our contact information, the email address, of course, not the email address, of course, you would know the email address, the phone number, the fax number to our office, and you can also go on our website and check out all the things that we have on there, including the sections entitled What is VaxD, Meet Our Staff and Doctor, and just take a look at all the ins and outs of all the great information we have about our therapies that we offer all under one roof right here at the American Back Centers. Also, you can scroll down and subscribe to our daily health update newsletter, which is sent to your email free of charge daily with some great health tips, mental attitude, health alerts, diet, exercise, chiropractic wellness prevention, and an inspirational quote each and every day to start off your day. So if you don't have time to read it, of course, you can just skip it over, delete it, and you'll get a new health tips each and every day sent to your email. If you want to opt out at any time, of course you can. And you automatically, and this is a great free service, you automatically get signed up for the monthly In Good Hands newsletter. And this is some of the greatest minds, the chief wellness director, medical director of wellness at the Cleveland Clinic contributes to this article. There's a contribution from various well-known health gurus across the country. And this is really a nice thing. It comes out once a month when you sign up for the daily health update newsletter. It's free. You get it once a month. It's about a 10-page, 7 to 10-page health articles. It's sent your email free of charge once a month. It's called In Good Hands newsletter. So you automatically get that free of charge when you sign up for the daily health update newsletter. Again, go to our website and do that. And you can sign up for that today. Again, it's a free service. You can also learn more about our office and what we do. You can visit our blog as well, www.drpeterpeduzzi.blog, blog.com. Great information that's updated each and every week on back pain, neck pain, headaches, carpal tunnel, whiplash, and more. Check out our website, again, www.AmericanBackCenters.com. Again, that's plural, centers.com, as well as our blog, www.drpeterpeduzziblog.com. Don't forget, you can call our office to schedule a consult or request an appointment right on our website, again, www.AmericanBackCenters.com. In addition to the VaxD, we just touched on the VaxD, a medical procedure, the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there, used by MDs, DCs, orthopedic surgeons, physical therapists worldwide. We also offer a cervical disc treatment. If you have a bulging herniated disc, degenerated disc, even failed neck surgery, you're contemplating neck surgery, you want a second opinion. We've helped so many people over the years avoid neck surgery. We have a lot of great testimonials on our website. If you've already had failed neck surgery, of course, we may be able to help you as well, but you just need to come in and talk with us. If you have films, bring those in. We can take a look at that and then determine if we can accept you for care. If we think you're a good candidate, we, of course, will accept you. If not, we will refer you to the appropriate specialist. We also do therapy and rehab, state-of-the-art facilities, individualized programs, ergonomic and postural instruction. We treat wrist, hand, finger, foot, ankle, knee problems, examples including tendonitis, rotator cuff, carpal tunnel, and much, much more. Deep tissue massage, myofascial trickle point therapy, acupressure, reflexology, licensed massage therapists instituting those type of care. Comprehensive nutritional consultations, as we mention each week through standard process. We can send them out to you. If you can't make it to our office, you can send them back to us, and we will score it for you. Custom-made orthotic, computerized digital scanning system, assessing for foot dysfunction. Patients love them. I have them in my feet, or my shoes, I should say. I wear them every day. They make a true difference. I have patients every day that have a last maybe 5 to 10% of their problem. They feel they still have a little bit of pain in some cases. And as we always talk about, it starts from the ground up. And assessing any possible foot issues, which could correlate into the hip, the knee, the back, all the way up into the neck in many cases, and it truly makes a difference because they are truly custom-made. Many people claim custom-made, as I talk about all the time, but we're not going back the same day and taking something off a shelf. This is actually sent away and made based on your electronic scan, and it's sent back to us in approximately 5 to 7 business days with a truly, again I say truly, custom-made orthotic. We also offer in-house X-ray. We do nerve conduction, ultrasound testing if you need that specialized testing. There's an outside facility, Lakeside Medical, that comes in and does that. A convenient MRI facility right across the street. If you need an MRI CT, we can write your prescription, and you can go literally right across the street. So it's very convenient, especially for out-of-town patients. We have people coming from out of state, hours away, across the state, and we do have a list of hotels, coincidentally, on our website as well, www.americanbackcenters.com. If you need overnight lodging, we can help you with that. There's some suggestions on our website. But it's very convenient. When people come out, they don't have an MRI. We decide we need one before they can proceed. In many cases, they can get an MRI the same day, come right back over, if we can squeeze them in, and take a look at the films, and then make a determination the same day in many cases, so they don't have to make another special trip out here just to see if they're a candidate after they receive the MRI or CT scan. Also, I'm a certified personal trainer as well as, of course, a doctor. We can get you back in the gym, doing things correctly, giving you appropriate recommendations on what you should and should not be doing so you're not injuring yourself. We get you out of pain. We don't want you to be right back in the office getting in pain because something silly you did in the gym and you end up hurting yourself. So VAXD, some of the common questions we have all the time, what is VAXD? VAXD stands for vertebral axial decompression. It's a non-invasive spinal decompression treatment used for a number of low back-related conditions, including herniated disc, balding disc, extruded disc, ruptured disc, degenerative disc disease, Facet syndrome, spinal arthritis, as well as spinal stenosis. And finally, failed back surgery, in many cases, is effectively treated with VAXD therapy as well. It's a very effective, safe procedure that simply decompresses, takes the pressure off the disc in your lower back, and not to be confused with a lot of these other treatments that claim to decompress the spine. VAXD actually creates the negative pressure, which is unique. Negative pressure is upwards of a negative 200 millimeters of mercury. Again, this was verified by clinical research published in the journal Neurosurgery way back in 1994. And to date, no other so-called traction device or any device that claims to be similar to VAXD has been able to replicate this type of research, proving that they actually create negative pressure. And again, you need to create that negative pressure to reduce the pressure within the disc, creating that vacuum, pulling that disc material, the fluid, nutrients, back into that compressed, starved disc, opening up the disc space, restoring height, and more importantly, restoring fluid and nutrients back into that desiccated disc, and also taking the disc off the irritated structure, whether it's the nerve, out of the canal, relieving your spinal stenosis, which is what is the actual cause of the problem. With VAC-C, it's actually possible to correct disc herniations and bulges without surgery. It's even possible to reverse disc deterioration, again, without surgery. So that's what makes VAC-C very, very unique. Prior to invention of VAC-C, the only documented way to actually correct a disc herniation or disc bulge was surgery. And no question about it, people have been helped by surgery, but it's very rare, especially this day and age where surgery has a very low success rate. And the problem with surgery is it's a permanent procedure with possible permanent complications. We see it all the time where patients may have some success initially with surgery, then it's only a matter of time till the compression, which is not being addressed, comes back. When they do a fusion surgery, of course, we know the areas above and below now have to eventually compensate for that fused segment that was used to, should be moving. Now it can't move because it's fused. So they took care of the compression of that area, but now that area can't move, so something has to compensate. When we talk about taking a link out of a chain, that's what happens. So something has to compensate for that lack of movement. So that's why these people end up with these problems, and this is not including the scar tissue. The infection, the bleeding, the blood clots can occur with any surgery, especially these type of spinal surgeries. The bottom line is hardly anyone would choose surgery if there was another option because of all these unwanted side effects that can occur and the lack of success with back surgery. And when VAC-C came out, there finally was a natural, safe alternative to back surgery. And since then, for the last 20-plus years, over 3,000 patients a day, of course, are being treated with VAC-C therapy. We've seen thousands of patients just here at our office over the last 20 years, and we've been able to help so many people with a documented over 92% success rate with this type of procedure. Our protocol, as we mentioned, is unique. Our protocol is physician-directed. Our protocol engages other modalities as needed on a case-by-case basis. Every patient is treated as an individual. We have over 20 years of experience, one of the most experienced facilities in the country, instituting this type of care. And as we mentioned, we screen out and decline candidates whose medical records and evaluation indicate we're unlikely to help them. So if we can't help you, of course, we will refer you to surgery or refer you out to the appropriate specialist. The VAC-C table and its computer work with each individual patient, adjusting back tension, which in turn adjusts interdiscal pressure within the disc moment by moment. The computer inside the table adjusts the tension in small amounts so that the muscles in the lower back do not spasm or contract during the treatment, which allows for true decompression to take place. So finally, if you'd like to schedule a consultation, of course, you can go on our website, www.americanbackcenters.com, and request an appointment. Of course, you can call our office as well, 724-935-3300, or toll-free 1-888-222-8293 as well, and schedule a consultation at no cost or obligation. We sit down with you. We verify all your insurance information. If you have any copay, deductible, co-insurance, all that's given to you before we do any type of treatment plan or even proposed treatment plan. You know exactly what if you have any out-of-pocket expense whatsoever. And more importantly, we answer all your questions. We encourage you to bring somebody in with you when you come in for your consultation. Number one, it's helpful to have somebody drive you out here, of course, if you're in pain. Whether it's a spouse, family member, or friend, it doesn't really matter. It's not imperative. It's not essential. But if you can, try to bring somebody out. Bring in your films, if you have any. Bring in your x-rays. Bring in your MRI, CT scans. It just gives us a better indication. Even if they're older, we can still use them to compare into the future. If we do need to order after doing a history and exam, we find there's medical necessity, we will order a MRI, CT. We can do the x-rays right here at the office. Remember, we have a MRI facility right across the street if need be. So it's very, very convenient for you. And again, we will determine if you're a candidate for the VAC-C, for the cervical disc treatments, if you have a neck disc problem in the neck, or any of the other treatment options we offer here all under one roof right here at the American Back Center. We also had a free video. This is when Channel 11 WPXI did a medical breakthrough Breakthroughs Report. Of course, we were on Channel 11 News. This is on a DVD if you'd like to see this. It's a great way to see the vaccine in operation. You can throw it into your DVD player if you still have a DVD player. You can throw it into your computer, and whatever plays a DVD that you have at home, and take a look at it. We're very proud of it. It's when Channel 11 heard about all the success we've had and put us on Channel 11 News. And there's some great patient testimonials on this DVD as well. We also have the research papers we touch on all the time. We're very proud of the research that was published in the Canadian Journal of Clinical Medicine. This research is done right here at the American Back Centers on VAC-C therapy. We also have the Knife in the Back article, which we touch on each and every week, showing the failures of back surgery, specifically fusion surgery, and why surgery is not the best approach for chronic back pain. Also, we have the blue workers' comp book, which we touch on each and every week, and the yellow auto accident and personal injury booklets. Great resources, as I stress each and every week. So many people get taken advantage of by the workers' comp system. They're hurt at work. They're told a lot of falsehoods about what they can and cannot do. I hear it all the time, where they try to rush them back to work because they just don't want to pay for any type of medical care for them. They don't want them off work too long because then they have to pay them compensation. This booklet shows you your rights, and you'd be surprised how many people don't know what they can and cannot do. They're told simple lies, and I hate to say this, but it's the truth, by their employer. That I've heard stories where a person twisted when they went to to take something off a counter, and they were told by their employer that you can't file workers' comp because you have to be lifting something. You know, something stupid like that, and these people believe it. And so many people are taken advantage of. So if you know someone that's been hurt at work, you yourself, if you'd like to just have this booklet on hand, I'm not advocating you file a workers' comp claim, but it's good to know what your rights are as a worker in the state of Pennsylvania. So if and when, and hopefully never, you get hurt, you're not taken advantage of. So this is a free booklet. It's done by an attorney out in the Philadelphia region. So they're not going to be calling you or soliciting you. They do this as a free service to our office, and we're very grateful that they do it. So if you'd like the blue workers' comp booklet, call us today and get it, or the yellow auto accident personal injury. We see a lot of whiplash cases here. We have great rehab programs for whiplash cases, car accidents, slip and falls. We work with some great attorneys as well. If you have work-related injury, you may have lifted something at work. You may have gone through your workers' comp panel doctors. They're not helping you. They want to send you back to work. You're still in pain. You may need a second opinion. You may have a disc problem, and we can only know that by coming in, doing a consultation, possibly ordering an MRI, and confirming that. And again, call us today to schedule a consultation for that as well, and get the blue workers' comp book or the yellow auto accident booklet, again, totally free from our office. A little bit more about the VAC-C. The computer in the VAC-C, a very sophisticated treatment, is designed to relieve pressure on the structures that may be causing your back pain, as we mentioned. But this very sophisticated computer samples the tension and position of the tension source hundreds of times each second while you're undergoing the therapy. It uses this biofeedback to process the data and adjust the tension to produce a perfect logarithmic decompression curve regardless of patient size, weight, or body structure. So why do you need this tension to be applied logarithmically is the question. Going back to basic physiology, Fechner's law tells us that the body senses response to the logarithmic of the stimulus, sight, sound, pressure, etc. So in order to fool the muscle proprioceptors and avoid muscle contraction, which we see with standard decompression and traction devices, we apply the tension in a reverse logarithmic curve. Hence, the back muscles relax with VAC-C, and the disc pressure can then be lowered to negative levels. The miracle of this technology and dynamic performance is the treating physician can choose to apply the tension to the patient and have the tensometer head move in a dynamic arc or curve while the tension is being applied. The tensometer head can then be programmed to follow the curve similar to the lumbar spine or the cervical spine, depending if you're receiving the neck or the low back treatment. So that's what makes VAC-C unique, and no other so-called decompression device can claim that. And working off that logarithmic curve, and it's unfortunate. You got to be very careful though, because there's a lot of devices out there actually using the VAC-C research as if it was its own on their websites and such. So you have to be very careful about that. And that's why I always say ask the doctor, what procedure are they actually using in their office? Because there's a lot of trickiness and a lot of things going on that are not the best as far as using these things in their actual websites. And again, with the unprecedented success of Vaxi for low back pain, there's been many copycat machines quoting Vaxi's research. Beware these traditional traction tables that advertise as decompression. Vaxi is a patented technology that is cleared by the FDA. It has published results in proven decompression of the disc. We can see study after study after study. Ask any doctor to see the research before you pursue these so-called disc treatments. Every week I see patients that have tried these other so-called decompression tables. Be careful what they are selling to you. And we have many, many studies confirming the effectiveness. We talked about the Journal of Neurosurgery, Ramos and Martin, 94, Journal of Neurological Research, Canadian Journal of Clinical Medicine, Journal of Neurological Research. The list just goes on and on and on. Independence Blue Cross Blue Shield. Many, many studies that continue to be done on Vaxi proving its effectiveness. Again, 20 years down, 20-plus more years ago, we continue to help people with this wonderful technology called Vaxi therapy. So finally, the question should always be, why would you even think about surgery with all its complications and lack of success, not including the normal risks, including infection, bleeding, and blood clots, when Vaxi is an option? Remember, Vaxi is a non-invasive treatment with a much, much higher success rate than surgery, pain injections, or physical therapy. Many patients go this route first and eventually end up at our office wishing they would have come to us much sooner. Remember, Vaxi addresses the structural issues, not just the symptoms. Truly, decompressing the disc, restoring the fluid content to that degenerated, desiccated disc, taking the compression, the cause of the problem, off the spine of the disc, relieving your pain associated with low back pain, disc problems, herniated or degenerated, sciatica, stenosis, numbness and tingling, foot drop, and even failed back surgery cases. We touched on how we also have the neck treatment. If you have a disc problem in the neck region as well, we possibly can help you with that as well. So some of the other frequently asked questions, I'm just going to get on the list here. What is Vaxi? How does it work? Vaxi, again, is a patented medical technology that gently decompresses the spine and disc. Pressure in the lower spine can be during Vaxi as high as 180 millimeters of mercury during many common daily activities, especially sitting and bending. As we've touched on this show many, many times, sitting is actually more compressive than standing. Hence, we're seeing why we touch on this show many times, why people are looking into standing desk. You're going to be changing positions throughout the day. That's key. You're not creating a one position all day, especially sitting position, which puts tremendous amount of compression on the spine. Vaxi is able to reduce the pressure on the lumbar spine down to levels of a negative 160 millimeters of mercury to a negative 200 negative millimeters of mercury, relieving the pressure on your pinched nerves. In short, Vaxi breaks the cycle of pain caused by bulging, herniated, extruded, degenerated disc, and helps the body heal itself. All right, we're going to get into the nutritional segment here in a few moments, but first, as we do each and every week, we're going to highlight some of the other services we offer, including, we touch on most of the other services we offer, but some of the other services we offer, including the LipoLite and some of the highlighted supplements, which we talk about from time to time that we are seeing great results with. But first and foremost, the LipoLite. As we're getting into the summer months soon, we're still in spring, but getting close. Hopefully the weather improves here. We had a nice stretch here, and now it's getting a little bit cold, but it's not bad. Still in the 70s, still can't complain. A lot of people are looking to get ready for the beach or look to get ready for their swimsuits, the pool. So LipoLite is a very safe way to slim, shape, and tone. With regular use, you can expect to lose in the region of 1 to 3 centimeters. So if you're looking at 6 to 12 treatments, that's where you're looking at 1 to 3 inches in the area that you want it. And LipoLite triggers lipolysis in the fat cells, which causes fatty acids to be broken down and released. LipoLite stimulates fibroblasts in strengthening the collagen and elastin fibers to tone and tighten your skin. We do have a special on Living Social right now, so if you want to take a look at the website, the app Living Social, you can get almost 50% off right now the normal price of LipoLite. I normally don't talk about that too much because obviously we'd be losing money, but I just wanted to offer that to you as a radio listener check out Living Social. We do offer almost, if not 50% off the normal price of the procedure if you sign up for a LipoLite package right on Living Social website. And it's a very safe way, amazing results with consecutive treatments, 6 to 12 treatments with this non-invasive, very effective treatment. We have great before and after pictures showing the true effectiveness of this wonderful procedure called LipoLite, and it's truly safe. You're just using the power of light therapy. There's not even a risk, small inherent risk with a laser. There's no laser involved with this. There's no radiation involved with this at all. It's just a light therapy that works. If you'd like to lose a dress size, if you'd like to lose a shirt size if you're a male, if you'd like a very safe way to slim, shape, or tone, you should try LipoLite. We've had great success with it. Women, men love it. We're booked up with this, but we can. You can call us and we can try to squeeze you in and get you in before the swimsuit season comes. It's called LipoLite. If you'd like to give it a try, give us a call here at our office, 724-935-3300. Also, if you're looking for the best all-in-one liquid multivitamin, the Intramax is the way to go. A lot of people are not ingesting what they're taking. They're taking these big horse pills. And as we talked about on the show many, many times, you're not digesting them. How could you? With a liquid supplement, such as Intramax, 415 different ingredients in an all-in-one ounce product. You take 1 ounce a day. All-in-one product, I should say. 71 organic trace minerals, 415 different ingredients, 100% carbon-bound organic. There's absolutely nothing synthetic in this product. No allergens, no toxins. Very safe, effective product that you're actually getting what you're paying for. We do offer a $5 discount or free shipping. If you want to ship it to your home for trying Intramax, I think you'll love it. We're so confident, that's why we offer that. We also have the IntraKids. We're not talking about pets here. IntraKid for the kids under the age of 18, if you'd like a liquid multivitamin for the kids. So again, this is a great product. I take it myself. My kids take it. Wonderful, wonderful product. Completely safe, natural, and I highly recommend it. All right, we're going to get into the nutritional segment today, the top 4 household factors that can influence your cancer risk. Remember, we touched on next week how cell phones can cause brain tumors. Don't get scared. Take a look at it on McCool.com if you'd like, and you'll see what we're talking about. There's going to be some great tips, some common things you may be doing that may be triggering this and causing more of a risk, so we'll touch on that next week. But today, top 4 household factors that can influence your cancer risk at home. So at a glance, research reveals that the greater your toxic exposure, the higher risk for cancer. Countries with the highest environmental pollution average 39 more cancer cases for every 100,000 residents each year. Lowering your toxic burden can help reduce your risk of cancer and other chronic illness. By addressing air quality, water quality, lawn and garden care, which we'll touch on today, and flame retardant furnishing, you've covered significant ground. Indoor air pollution is thought to be one of the greatest hazards. According to WHO, 92% of the world's population breathes polluted air. And the EPA warns poor indoor air quality is a top public health risk. As we go on to start the first article, again, this is from Mercola, MERCOLA.com. And I've noticed with Dr. McCool, I'm taking a postgraduate course in functional medicine, so I'm hoping to give you a lot more information from what we're learning in our postgraduate course in functional medicine and eventually be able to help a lot more people, too, with functional medicine. If you don't know what functional medicine is, we'll touch on that more in the next couple months as I go through my postgrad course. But McCool actually contributes a lot to the, not seminars, but the lectures that are involved in this postgraduate course. So I like to use a lot of his information and on my radio show as well because it's very accurate and it's very up-to-date. So he goes on to state, the fact that toxic exposures will influence your risk for disease and early death should come as no surprise. According to the World Health Organization, toxic environments are responsible for at least 1 out of 4 deaths reported worldwide. Recent research also reveals the greater your total pollution exposure, the higher risk for cancer. As reported by Reuters, while previous research has linked individual pollutants to increased risk of specific types of cancer, The current data focuses on how the combined effect of exposure to a variety of environmental contaminants may influence the risk of tumors. It goes on to state, compared to countries with the highest environmental quality, countries that ranked lowest had an average of 39 more cases of cancer each year per 100,000 residents, as we just mentioned. We don't experience exposures in a vacuum, but rather we're exposed to several exposures at any one time. This is from a PhD at the University of Illinois at Chicago. We consider a broad definition of environmental exposures, which include pollution in the air, water, and land, and also man-made, and social, demographic, environmental factors. We found that countries with poor overall environmental quality experience higher cancer incidence than those countries with good overall environmental quality. Prostate and breast cancers were strongly associated with environmental quality. Next paragraph, 4 major sources of toxic pollution in your home. According to Dr. Lee Coden, board-certified cardiologist who's developed an exceptional teaching program, more people die from cancer treatment than from cancer itself. He may be correct, however, how toxic most conventional cancer treatments are. Without doubt, an ounce of prevention is worth a pound of cure when it comes to cancer. And cleaning up your living space can go a long way to lowering your toxic burden. While the sources of environmental pollution are many, 4 major sources of toxic exposure in your home are, number 1, which we'll be addressing today, indoor air pollution. Number 2, contaminated water. Number 3, toxic lawn care. And I actually use a service of our home that's completely organic. There's no toxic chemicals. And if you like that, I actually put on the Facebook page, you can private message me, and I can give you the number, information on their service if you'd like to try a organic, non-chemical lawn service. Number 4, flame retardant furnishings. So next paragraph, beware of toxic dust. Indoor air pollution is thought to be one of the greatest hazards. According to WHO, 92% of the world's population is breathing polluted air. The U.S. Environmental Protection Agency, EPA, has warned that poor indoor air quality is one of the top public health risks. As we skip on down, we talk about, in fact, studies demonstrate that indoor pollution levels may be 2 to 5 times higher than outdoor levels. And poor air quality can cause serious damage to your lungs, heart, and other organ systems. The materials found in your home are often a significant contributor to poor indoor air quality. Flame retardant chemicals, for example, commonly found in furniture and carpeting, do not remain inertly bonded within the foam or fabric. They escape in the form of dust into the air. One study found that every dust sample collected in American homes contained triphosphate and triphenyl phosphate. 91% of urine samples from the residents also contained these items. Other tests have shown that 90% of Americans have flame retardant chemicals in their bodies, and many have 6 or more types in their system. Disturbingly, children have been found to have levels of flame retardants that are as high as 5 times higher than in their mothers. Next paragraph, how to remediate poor air quality. He goes on to state, considering how impure the air is in most homes, you'd be well advised to implement one or more of the remediation strategies. Following are a handful, of basic strategies. Even more tips on how to reduce indoor air pollution, as well as different air purifier technologies available, see the previous air quality article that he has on his website. So number 1, regularly ventilating your home. This recommendation is virtually free. All you need to do is open up your windows on opposite sides of your home for 5 to 10 minutes every day to cross-ventilate. We have screens in our front door and our back door, so we try to open them up every day for at least 10 minutes. Cross-ventilate, front of the house, back of the house. This goes a long way to help radically reduce your indoor air pollution. Install a HEPA filter in your HVAC system and upgrade your furnace filters. Be sure to change your AC filter every 3 months, or earlier if dirty. Have your furnace and air conditioning, ductwork, and chimney cleaned regularly to avoid any type of toxic buildup. Number 3, use a high-quality air purifier and keep it running 24/7. Avoid keeping air purifiers on the floor to avoid stirring up dust. Ionizing air purifiers generate negative ions that attract and trap dust and allergens. Just make sure your system is suitable for the size of your space. Using too powerful a system for a small space can lead to excessive ozone buildup, which may do more harm than good. Ozone levels up to a 0.05 are safe, parts per million, according to the U.S. Food and Drug Administration. When it comes to air purifiers, as long as they limit ozone levels in your home to between 0.02 and 0.04, they offer great health benefits without any negative effects of the too much ozone. Next, avoid as many household chemicals as possible. For example, ditch carpet fresheners, air fresheners, chemical cleaning supplies, and replace them with non-toxic versions. We've touched on this on the show many, many times. Many cleaning products can be replaced with baking soda, vinegar, hydrogen peroxide, water, and mild soap. For a fresh scent, use high-quality essential oil. So you can add the essential oil to your vinegar, to your baking soda, to your water and soap, which can be used in a diffuser or added to your cleaning solution. Next, add live plants. Studies have demonstrated that plants can improve your indoor quality, removing pollutants by absorbing them through leaves and roots. Many leafy plants are adept at removing some pollution from the indoor air, but some of them are better at removing volatile organic compounds. Among the most beneficial houseplants, based on their ability to clean air and remove these volatile organic compounds, are the jade plant, again, jade plant, spider plant, scarlet start, Caribbean tree cactus, ferns, peace lily, English ivy, fiscus, snake plant, and bamboo palm. Recent research also suggests that taking B vitamins can help protect against indoor air pollution. High doses of B vitamins were actually able to completely offset damage incurred by fine particulate matter. Next paragraph, water filtration is necessary in most homes. Drinking water contamination is also widespread, both among the community water and private wells, and aging water pipes add to toxic exposure. The list of water contaminants is so long, ranging from nitrates, runoff from factory farms, and drugs to fluoride, arsenic, mercury, lead, PVCs, as well as other toxic chemicals. Chemicals used in water treatment, such as chlorine, can also create highly toxic disinfectant byproducts. Chemicals from perfumes, colognes, lotions, sunscreens, medicated creams also add to the contamination problems. Old, worn-out pipes deposit lead, copper, and harmful bacteria into many people's homes. Since most people's water supplies are severely contaminated, filtering water prior to use is more of a necessity than a luxury these days. If you have well water, it's prudent to have it tested for contaminants on a regular basis. If you get local drinking water, quality reports from public water supplies from the EPA you can receive. Ideally, your best bet is to filter water at both the point of entry into your home and the point of use. This means installing filters where water enters your home, and again at the kitchen sink and showers. A whole house water filter will last you about 3 years, costing you roughly $1 per day, a worthwhile investment, all things considered. If your water comes from a municipal source, it can affect your indoor air quality, courtesy of the evaporating chlorine from toilets, showers, baths, dishwashers, and washing machines. Evaporated chlorine forms a chloroform gas and vapors that may increase your risk of asthma, airway inflammation, and respiratory allergies. Open your windows again, 5 to 10 minutes each day, to help remove these gases and improve your air quality. One of the best water filters he's seen so thus far is Pure and Clear Whole House Water Filtration System, which uses a 3-stage filtration system to filter out chlorine, detergent byproducts, and other contaminants. Next paragraph, is your lawn and garden toxic? We talked about my service that I use that's organic, but a lot of people are using these services with, as we talk about all the time, and it's a big buzzword now, glyphosate, the active ingredient in Roundup, has been known as a possible human carcinogen. We're seeing this problem with genetically modified foods these days. Still in the U.S. it's not mandated that genetic modification labels are put on items. In Europe it is. A lot of your lawn services are using this Roundup, of course, very toxic chemical, especially for your family, but even more especially for your kids. So it looks like we have about 2 minutes to go, so I don't know if I'm going to get through the entire article, but we can finish it up for sure next week. But if you'd like a copy of the article, of course, go to McCullough.com. You can go to our Facebook page, American Back Centers Pittsburgh. You can like our Facebook page. If you have a second, please do that. And you can also print right off the American Back Centers Facebook page. Top 4 household factors that can influence your cancer risk. We'll summarize that and finish that off next week. Also, how cell phones can cause brain tumors and trigger chronic disease. Again, we're not trying to scare you. You're not going to get a brain tumor from using a cell phone right away, but just gives you some things to think about as far as use of cell phones and some things you can do to help minimize exposure to these electromagnetic waves, which we'll be touching on next week on BackTalk. So definitely stay tuned for that as well. I do want to remind you, visit our webpage, www.americanbackcenters.com. And again, you can subscribe to our daily health update newsletter free of charge. You automatically get signed up for the monthly In Good Hands newsletter. Request an appointment right on the website as well. Again, www.americanbackcenters.com. And learn more about all the great treatment options we offer, all under one roof, right here at the American Back Centers. All right, we're short on time, so as always, I'm going to leave you with some final closing thoughts. Remember, do your homework before pursuing any treatment option. We touched on some of the various people trying to mimic vaccines, some of the copycats. Ask for the research. Go on the Internet. Ask the doctor what the actual name of the procedure is, not something made up. What is the name of the actual table? There's many scams out there. With Vaxd, you don't have to worry about that. It's been around for 20 years. It'll be around for another 20-plus years. It has a proven track record. It's time-tested, well-researched, used worldwide. Approximately 3,000 patients a day are currently being treated with Vaxd therapy. Accepted by all fields of healthcare, and most importantly, it's something that actually works. With Vaxd, the results speak for themselves. I want to thank everyone for listening. We'll be on every Wednesday, next Wednesday, with another episode of BackTalk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to BackTalk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for BackTalk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.